In this video, I will tell you, does sports-related activities can cause back pain? Whenever you step out onto the playing field or into the gym, you run the risk of suffering some sort of injury. Back injuries are among the most common, whether you're a committed and competitive athlete or a weekend warrior. Around 90% of these acute back injuries will get better on their own, typically in about 3 months. However, sometimes back injuries can be a bit more serious and require a doctor's care. Sports-related back and spine injuries vary somewhat with the sport, but a few of the most common include: cervical means neck injuries. Some injuries occur more often in certain sports. For example, in football, we commonly see stingers, which is a type of neck injury. When a player suffers a stinger on the field, it should resolve very quickly. Lumbar means lower back sprains and strains. You could get one of these injuries in the gym if you try to lift too much weight or use the improper technique when lifting. Acute injuries like lower back sprains and strains typically resolve on their own. Often, you don't need a doctor to evaluate them further. Treatment for minor lower back pain is generally self-directed. For these types of injuries, you can take over-the-counter anti-inflammatory medications like ibuprofen or naproxen. Fractures and other injuries to the spine's supporting structures. In sports that involve repetitive extension movements, such as volleyball, gymnastics, diving, cheerleading and dancing, spine stress fractures are fairly common. This type of injury causes lower back pain. Doctors diagnose spine stress fractures by reviewing an X-ray or CAT scan and usually treat the injuries with a back brace and rest. However, in certain instances, these injuries require more aggressive treatment. Let's say you have injured yourself playing a weekend game of tackle football, or hurt your back when doing back squats at the gym. Now you're in pain and don't know whether you should see a doctor or just take some over-the-counter pain medication and wait it out. If you experience any of these warning signs, then you should probably get to a doctor for further evaluation. Your back pain gets progressively worse. The pain radiates to your legs or causes weakness. You experience bladder or bowel changes. Your pain affects your balance or walking. Your pain persists for more than 2 months. The muscles and supporting structures of the back weaken when you remain in bed for days on end. This can lead to a vicious cycle of continued back pain. Back injury prevention. There are ways to reduce your risk of suffering a serious back injury. Strengthen your core. Use proper form and technique when lifting or performing. Warm up and stretch. Get plenty of sleep. Maintain ideal body weight. Participating in sports is a great way to stay fit and emotionally healthy, regardless of age. Don't let a back injury keep you out of the game. If you enjoyed this video, then you may like to check out our free guide, The Complete Back Pain Relief Program. You can download it for free from the link in the description below. If you want to make a video like this, then check the second link in the description below. You will also get a 7 days free trial for this software. Thanks for watching. Subscribe and share this video with your friends and family who have a back pain problem and get a benefit from this video.